Hey everyone, and welcome back. We're going to be doing a really interesting deep dive today. We've got a lot of thought-provoking stuff to cover at the intersection of public health and personal choices and all those crazy medical developments that seem to be happening all the time.
Yeah, and how all these topics kind of touch on the choices that we make both as individuals and as a society as a whole.
Right, exactly. Like those choices really do have an impact on everyone's well-being.
For sure.
Okay, so to get us started, we've got a CDC report on a new way to prevent STIs, a framework for taking care of older adults, an overview of medical imaging techniques, and even a discussion about cutting back on salt.
Oh, and don't forget the news. We'll be talking about the measles outbreak, Pope Francis's health.
Oh,
And-
and King Charles inviting Donald Trump for a second state visit to Britain.
Now that's something I didn't see coming.
It's definitely a head-scratcher.
It is.
Okay, well, let's jump right in. First up, we've got this CDC report on Doxycycline Post-Exposure Prophylaxis, or Doxy-PEP for short. Right. It sounds kind of intimidating, but it could be a game changer when it comes to preventing STIs.
So just to clarify, Doxy-PEP involves taking the antibiotic doxycycline after a potential exposure to an STI.
Okay, so it's kind of like a safety net.
Exactly. It's
Uh-huh.
similar to the idea of PP for HIV, post-exposure prophylaxis.
Right, right. And the research on this is pretty impressive. Like for men who have sex with men and transgender women, Doxy-PEP has been shown to reduce syphilis rates by something like 70%.
It's really quite remarkable.
Yeah, and it's also been shown to significantly reduce rates of chlamydia and gonorrhea, too.
And based on all of this evidence, the CDC is now recommending Doxy-PE for men who have sex with men and transgender women who've had a bacterial STI in the past year.
Okay, so that's a pretty specific group.
It is, but it's important to remember that for other populations where the data is still limited, the decision to use Doxy-PEP should be made between the patient and their doctor, based on their individual needs and circumstances.
Right, so it's all about personalized healthcare.
Exactly.
Okay, so let's get down to the nitty-gritty. How is Doxy-PEP actually taken?
Well, it's pretty straightforward. It's a single 200 milligram dose taken within 72 hours of a potential exposure.
Okay.
And doctors can adjust that dosage, based on individual needs and medical history.
So how does Doxy-PEP fit into our overall approach to sexual health? I mean, is it like a magic bullet or...
That's a great question. And the short answer is no, it's not a magic bullet. It's important to remember that Doxy-PEP is just one part of a comprehensive sexual health strategy.
Right.
So it's still essential for people to have access to things like counseling, regular STI screenings, and preventative measures like condoms.
Okay, so it's not a replacement for those things.
Definitely not. It's about adding another layer of protection.
Got it. So listeners, what are your initial thoughts on Doxy-PEP? What questions would you want to ask your doctor about it? It's definitely something to think about.
For sure.
All right, shifting gears a bit. Let's talk about the 5 M's of geriatric care.
This is such an important topic.
Yeah, it really is. This framework is designed to ensure that older adults are getting the essential care that they need.
And it's becoming increasingly important as our population ages.
Exactly. Older adults often have complex needs, and they may be dealing with multiple health conditions.
Absolutely. So how do these 5 M's actually work?
Well, think of each M as like a quick assessment tool.
Okay,
It's a way for healthcare providers to quickly identify any potential issues.
I like that.
So the 5 M's are mind mobility medications, what matters most, and multicomplexity.
Wow, that's
Yeah.
quite a mouthful.
Right. Okay, so mind focuses on cognitive function. Like, are there any signs of memory problems, depression, or delirium?
Okay, and what about mobility?
Mobility looks at things like fall risk. Like, is the
Mhm.
person steady on their feet, or are they at risk of injuring themselves?
Got it. And I'm guessing medications is a big one for older adults.
Oh, yeah, huge.
Yeah.
Polypharmacy, taking multiple medications at the same time can be a real issue.
Oh, for sure. It can get really complicated and even dangerous if it's not managed carefully.
And then there's what matters most. This M focuses on ensuring that medical care aligns with the patient's own goals and preferences.
So it's about respecting their autonomy and their wishes.
Exactly. And finally, multicomplexity recognizes that many older adults are managing multiple chronic conditions, and that aging is about more than just physical health.
Right. It's about the social, emotional, and functional aspects of a person's life as well.
The article we read mentioned a couple of really practical tools that fit into this framework.
Like what?
Well, for example, there's the mini-cog test. It's a super quick assessment for cognitive impairment.
Oh, yeah, I've heard of that one. It's much faster than the traditional mini mental state exam, right?
Yep,
Yeah.
exactly. And then for mobility, there's the steady test for fall risk.
Okay.
And get this, it's only 3 yes or no questions.
Wow, that's amazing.
Right. Talk about efficient.
So simple.
I know. And what I find really valuable about the 5Ms is the emphasis on advanced care planning.
Right.
As people age and their health might decline, it's crucial to have these conversations early on.
Absolutely. It's about ensuring that their wishes are respected.
So the 5Ms really highlight the need to look at the whole person, not just their list of diagnoses.
It's a holistic approach.
And I think that's something we could all benefit from, not just in geriatric care, but in all areas of healthcare.
Couldn't agree more.
So think about the older adults in your life. How could understanding this 5Ms framework change how you interact with them or advocate for their care? Something to really consider.
Yeah, it is.
Okay, time to tackle something that I think everyone can relate to. Medical imaging.
Oh, yeah. I mean, who hasn't found themselves in a hospital staring at an X-ray or wondering what's going on inside that giant MRI machine?
Right. It can be a little intimidating.
To say the least.
This article we have does a great job of breaking down all the different types of imaging techniques, and it addresses a lot of common safety concerns.
Let's start with the basics. Most people are probably familiar with X-rays.
Yeah, they're pretty much the OG of medical imaging.
Right. Simple, low radiation, and great for things like bone fractures or certain infections.
Then you've got CT scans, which are kind of like X-rays on steroids.
Ah, that's one way to put it.
They create those cool 3D images and offer way more detail, but they do involve a higher dose of radiation.
Okay, what about MRIs?
MRIs use magnets and radio waves, so no radiation at all.
That's good to know.
Yeah, they're amazing for visualizing soft tissues, but the scans can take a bit longer.
And some people find them a bit claustrophobic.
True. Then there's ultrasound, which is super safe and commonly used during pregnancy.
Ah, yes, the heartbeat monitor.
Exactly. And of course, we can't forget about mammograms and bone density scans.
Specialized scans for specific needs.
Right. The article also mentions that recent advances in technology have actually made MRIs safe to use during pregnancy.
Wow, I didn't know that.
Yeah, it's pretty amazing.
It is.
And it's so important to let your doctor know if you've had any previous scans.
Right? Why is that?
Well, it can help them avoid unnecessary repetitions, which minimizes your overall radiation exposure.
Oh, that makes sense. It's all about being proactive with your health.
Exactly. So listeners, think about your own experiences with medical imaging. What stands out to you? Have you encountered any of these techniques? Has this information changed your perception of them at all?
It's fascinating stuff.
Okay, ready to dive into the world of nutrition.
Always.
All right, so let's talk about salt. This article we have suggests that we might be reaching a turning point in how we think about and consume it.
Interesting. I know there's been a lot of talk about reducing sodium intake.
Right, so a recent study published in JAMA Cardiology looked at what happened when people replaced regular salt with a salt substitute containing potassium.
Okay, and what do they find?
Well, they found that this simple switch led to significant reductions in both stroke recurrence and death.
Wow, that's pretty impressive. Like, how much of a reduction are we talking about?
We're talking a 14% reduction in stroke risk and a 12% decrease in death.
Those are not small numbers.
Nope, they're not. It just goes to show that even small changes in our diets can have a big impact on our health.
Absolutely. And it's important to note that this study was conducted in China, which has one of the highest sodium consumption rates in the world.
Right, so those findings are especially relevant for that population.
Makes sense.
But I'm curious, do you think these findings could have implications for other parts of the world too?
I think it's worth considering for sure. High sodium intake is a global issue, so it stands to reason that reducing sodium could have benefits for people everywhere.
That's a good point. The article actually quotes a few cardiologists who weighed in on the study's findings.
Oh, really? What do they have to say?
Well, one of them, Dr. Melissa Tracy, sees this study as a potential tipping point.
A tipping point for what?
She thinks it provides really strong evidence for regulating sodium levels in food.
Interesting. Kind of like what happened with trans fats.
Exactly. But of course, there are always different viewpoints on these kinds of public health initiatives.
Of course.
Another cardiologist in the article, Dr. Luke Laffin, is a bit more cautious about jumping to regulations. While he agrees that reducing salt is important, he points out that most of the major studies on sodium, including this recent one, have been conducted outside of North America.
That's true.
So he'd like to see more research done specifically with North American populations before making any big policy decisions.
I can see his point.
And Dr. Laffin makes another really important point. A lot of people don't realize where most of their sodium intake is actually coming from.
Yeah, you're right. It's not just about how much salt we're shaking onto our food.
Exactly. Most of the sodium we consume comes from processed foods, restaurant meals, even things that's seem healthy, like bread and salad dressings.
It's kind of sneaky.
It really is. So what can people do to be more mindful of their sodium intake?
Well, first and foremost, become a label reader. Seriously, it's amazing what you'll find when you start paying attention to the sodium content on food packages.
That's so true.
And don't be afraid to ask for no salt options when you're eating out or ordering takeout.
That's a good tip.
A lot of restaurants are happy to accommodate those requests.
It's all about those small conscious choices.
Absolutely. Those little adjustments day by day can really add up.
So listeners, where do you think you could easily cut back on sodium? What challenges do you think you might face? It's definitely something to think about.
It is.
Now, unfortunately, we need to shift gears to a more somber topic. We have a news story here about a child's death from measles in Texas.
Oh, wow.
It's the first U.S. measles fatality in years, and it really highlights the importance of vaccination.
It's a tragic situation.
It is. The outbreak is centered in a Mennonite community which has historically had low vaccination rates.
I see.
And that's due to religious exemptions which are allowed by law in Texas.
That adds another layer of complexity to this whole debate.
It does. It's this ongoing tension between personal beliefs and the need to protect public health.
Right.
And measles is a serious disease.
Mm-hmm.
About 1 in 5 people who get measles end up in the hospital.
And in rare cases, it can be fatal.
And sadly, in this case, the child who passed away was not vaccinated.
It really highlights the very real consequences of vaccine hesitancy.
It does. The article mentions that Robert F. Kennedy Jr., who's been very vocal in his criticism of vaccines, actually downplayed the severity of this outbreak. So you've got people downplaying the risks, and then you've got medical professionals who are seeing the very real impact of this preventable disease.
It's a tough situation.
It is. So this story brings up some really profound questions about the role of vaccination in our society.
It does.
Do you think there's a need for greater awareness about the dangers of preventable diseases like measles?
I think that's a really important question.
Okay, let's move on to some more uplifting news. We have an update on Pope Francis, who was hospitalized recently with pneumonia.
Oh, right. How is he doing?
Well, his condition has been improving.
Oh, that's good to hear.
Yeah, he was admitted 2 weeks ago with breathing difficulties, and they diagnosed him with double pneumonia.
Double pneumonia. That's serious.
It is, especially considering his age and the fact that he had lung surgery a few years ago. So doctors are still being cautious. But the fact that he's showing improvement is really encouraging.
It is, and there's been such an outpouring of support for him from around the world.
Absolutely. He's a beloved figure, and people are really hoping for his full recovery.
Well, we're all wishing him the best.
We are.
Oh.
Okay, and finally, a bit of a curveball from the world of politics. King Charles has invited Donald Trump for a second state visit to Britain.
Wait a second. A second state visit? That's pretty unprecedented, isn't it?
It is. It's actually the first time a U.S. president has received 2 state visits from the same British monarch.
Wow. So what's the thinking behind this?
Well, that's what everyone's trying to figure out. The invitation was delivered by British Prime Minister Keir Starmer when he met with Trump at the White House.
That's interesting. It'll be interesting to see how this all plays out.
Definitely. Well, that wraps up part 1 of our deep dive. Stick around, though, because we'll be back soon with part 2, where we'll delve even deeper into these fascinating topics.
See you soon. Welcome back to our deep dive.
It's amazing how many different things can affect our health and well-being, isn't it?
Oh, it really is.
We were talking earlier about muscle relaxants and how effective they are for chronic pain.
Yeah.
So let's talk about that research article in a bit more detail.
You know, I think this research is really important because it kind of challenges some of the common assumptions about muscle relaxants.
Right.
For a long time, they've been seen as a go-to solution for chronic pain. But this study suggests that they might not be as effective as we thought.
Especially not for every type of pain, right?
Right.
And we were talking earlier about how prescriptions for muscle relaxants have been increasing. So these findings are even more significant now.
Absolutely. And, you know, it raises some concerns about potential overuse and the risk of side effects.
Especially since a lot of people are already taking multiple medications.
Exactly.
The study itself was really thorough.
Oh, yeah.
Yeah, they analyzed data from 44 different studies with over 2,000 participants. And they looked at all sorts of pain conditions like low back pain, fibromyalgia, headaches, muscle spasms, you name it.
So they really covered the gamut.
They did. And they were specifically looking at the long-term use of muscle relaxants, so like 4 weeks or more.
Okay.
And what they found is that while these medications might help with certain conditions, the evidence isn't as strong as you might think.
So for some conditions, they might not be as effective.
Exactly. Like, for example, they found that muscle relaxants could be helpful for treating trigeminal neuralgia.
Trigeminal neuralgia.
Yeah, it's a type of nerve pain that affects the face.
Hmm.
But for things like fibromyalgia, low back pain, and headaches, the evidence was much weaker.
Hmm.
In some cases, muscle relaxants were no more effective than a placebo.
That's really interesting.
Yeah, it is. And it shows how important it is to have a personalized treatment plan.
Because there's no one-size-fits-all solution, right?
Absolutely.
Yeah.
It's so important to have those conversations with your doctor about the potential benefits and risks of any medication.
And to explore other pain management options, too.
Right.
One thing that really stood out to me in the study was the discussion of side effects.
Oh, yeah.
Those can be a real issue with muscle relaxants.
The study found that the most common side effects were sedation, dizziness, and dry mouth.
And those can be pretty debilitating.
They can. And those side effects can get even worse when muscle relaxants are mixed with other medications.
Especially other medications that affect the central nervous system.
Exactly. So if you're taking muscle relaxants, it's super important to talk to your doctor about all the other medications you're taking.
Just to make sure there aren't any dangerous interactions.
Right. So the big takeaway here is that we need to be more careful about how we use muscle relaxants. They can be helpful for some people, but they're not a cure-all.
And it's important to be aware of the risks.
Okay, so let's get back to that study about salt substitutes.
Yeah.
It was really fascinating.
It was.
To recap, the study found that replacing regular salt with a salt substitute that contains potassium led to some pretty significant health benefits.
Like what kind of benefits?
Well, they found that it reduced the risk of stroke recurrence and death.
By how much?
The people who used the potassium-enriched salt substitute had a 14% lower risk of stroke and a 12% lower risk of death.
Wow. So it's really worth considering switching to a salt substitute.
It seems like it.
And it's a pretty simple change to make.
It is. You literally just swap out your regular salt for the potassium-enriched version.
Easy peasy.
It's a good reminder that small changes can have a big impact on our health.
And this study was done in China, right?
It was.
And China has a really high sodium intake.
Some of the highest in the world.
So these findings are especially relevant for that population.
But I'm curious, do you think these results could apply to other parts of the world too?
Possibly. High sodium intake is a problem in lots of countries.
That's true.
So it's reasonable to think that reducing sodium could benefit people everywhere.
Yeah. The article quoted some cardiologists who had some interesting perspectives on the study.
Oh, yeah. What do they say?
One cardiologist, Dr. Melissa Tracy, thinks this study is a real game changer.
Interesting.
She believes it's strong evidence that we should be regulating sodium levels in food.
That's a pretty big step.
It is. But we've seen it happen before with trans fats.
Right.
Of course, there are always different opinions on these kinds of public health issues.
For sure.
Another cardiologist in the article, Dr. Luke Laffin, is a little more hesitant about regulations.
Why is that?
Well, he agrees that reducing salt is important. But he points out that most of the research on sodium has been done outside of North America. So he wants to see more studies done specifically with North American populations before we make any big policy changes.
That makes sense.
And he also stressed the importance of consumer education.
Right.
A lot of people don't realize just how much sodium they're eating.
Yeah, it's not just about the salt we add to our food at the table.
It's in everything.
Yeah.
Processed foods, restaurant meals, even things that seem healthy like bread.
It's crazy.
It is. So what can people do to be more aware of their sodium intake?
Well, reading labels is super important.
Uh-huh.
You'd be surprised at how much sodium is in some of the foods we eat every day.
It's shocking.
And when you're eating out, don't be shy about asking for no salt options.
That's a good point.
Lots of restaurants are happy to accommodate.
Okay, so let's talk about that measles outbreak in Texas.
Oh, right. That was such a sad story.
It was, and it really brought the issue of vaccine hesitancy back into the spotlight.
This outbreak was centered in a Mennonite community, right?
It was. And they've historically had low vaccination rates because of their religious beliefs.
I see.
And in Texas, religious exemptions to vaccines are allowed.
So it creates this conflict between personal beliefs and public health.
It's a tough one. And measles can be a very serious disease.
About 20% of people who get measles end up in the hospital.
And in some cases, it can be fatal.
Which is what happened in this case, unfortunately.
The child who died wasn't vaccinated.
It's a reminder that vaccines really do save lives.
The article also mentioned that Robert F. Kennedy Jr. downplayed the severity of the outbreak.
Oh, wow.
Which is concerning because he's been a very vocal critic of vaccines.
I see.
So you have people downplaying the risks, and then you have healthcare workers who are seeing the very real impact of this disease.
It's a complex issue, for sure.
It is. What are your thoughts about this whole debate over vaccines?
It's a tough one. I think it's important for people to have access to accurate information so they can make informed decisions.
That's a good point. Okay, let's switch gears to something a little more positive.
Okay.
Remember Pope Francis, who was hospitalized with pneumonia?
Yeah.
He's been getting better.
Oh, that's wonderful.
Yeah, he's had 2 good days in a row.
That's great news.
It is. He was admitted 2 weeks ago because he was having trouble breathing,
Right.
and he was diagnosed with double pneumonia.
That's scary.
It is, especially at his age and after having lung surgery a few years ago.
For sure.
So doctors are saying it'll be a long recovery, but the fact that he's improving is
Yeah.
definitely a good sign.
And people all over the world have been sending him their best wishes.
Absolutely. He's a beloved figure, and people are really hoping for a full recovery.
We all are.
Okay, and for our last story today, we have a bit of a surprising development in the world of international politics.
Okay.
King Charles has invited Donald Trump for a second state visit to Britain.
A second state visit.
Yeah.
It's not something you hear every day.
It's actually unprecedented for a U.S. president to get 2 state visits from the same British monarch.
Wow.
The invitation was delivered by British Prime Minister Keir Starmer when he met with Trump at the White House.
Interesting.
So there's been a lot of speculation about what it all means for the relationship between the U.S. and the U.K.
For sure. It'll be interesting to see what happens.
Definitely.
And we're back for the final part of our deep dive.
It's amazing how much we've covered today.
I know, right? From STIs to SALT to international politics.
There's a lot to take in.
It is, but it's all connected in a way.
That's true. You know, one of the things that's really stood out to me is the power of choices.
Choices.
Yeah, like whether it's a personal decision about using Doxy-PEP or a societal decision about regulating sodium, our choices have consequences.
It's like that butterfly effect thing.
Exactly. One small choice can have a ripple effect.
And we saw that with the measles outbreak in Texas.
Right. That was a tragic example of how personal choices can have a real impact on public health.
It's a reminder that we're all part of a larger community.
And that our choices can affect others.
Exactly.
But on a more positive note, we also saw the potential for collective action.
Like with the SALT study.
Yeah. If we as a society make a conscious effort to reduce sodium intake, we could see some real improvements in heart health.
That's a powerful message.
It is. So it's all about finding that balance between individual freedom and collective responsibility.
And having open and honest conversations about these complex issues.
Exactly. We need to be informed and engaged citizens.
We can't just sit back and let things happen. We have to be willing to question our assumptions, do our own research, and participate in the conversations that shape our world.
Well said. So as we wrap up this episode, we want to leave you with a final thought.
Okay.
From the potential of Doxy-PEP to the surprise invitation for Trump to visit Britain. We've covered a lot of ground today.
We have.
So what insights will you take away from this deep dive? How will this knowledge inform your own choices?
Remember, knowledge is power, but it's only truly valuable when it's understood and applied.
So use what you've learned today to make a positive impact on your own life and the world around you.
And on that note, we'll wrap up this episode of The Deep Dive.
Thanks for joining us, everyone.
We'll see you next time.